All right, everybody, I'm Logan Alec. I'm a CPA, and this is my update for Wednesday, November 25th. First of all, thank you to everybody who watched part one of my interview with Dr. PJ yesterday right here on the channel. We basically talked about the basics of COVID-19, but today I will release part two here on the channel. In that part of the conversation, we got into the right way to wear masks, the difference between an N95 mask and a surgical mask. We also talk about how a vaccine was able to be developed within the span of a year, less than a year, because vaccine normally takes years to develop. How do these pharmaceutical companies come up with a COVID-19 vaccine in such a short span of time? Should we be concerned about that? We get into all of it. That video will be released here on the channel later today. Be sure to subscribe to Dr. PJ on YouTube. I'll put a link to his channel in the description below. In terms of stimulus, in my update yesterday, I mentioned that Joe Biden will nominate former Federal Reserve Chairwoman Janet Yellen as his Treasury Secretary, and I speculated that she will be confirmed, right? I believe she will be confirmed. I think she's a good pick. I think that she will be confirmed even if Republicans retain the Senate. Republican Senator Pat Toomey said this week, for example, that while he and Yellen have had their fair share of disagreements while she was chair of the Fed, he has no doubts about her integrity or technical expertise. And I kind of mused yesterday what stimulus-friendly Yellen might try to do in terms of those hundreds of billions of dollars that was appropriated to mostly unused lending facilities that our current Treasury Secretary Steven Mnuchin requested the Federal Reserve give back, and which current Fed Chairman Jerome Powell said the Fed would give back. Now, the media is making this a big circus right now, right, with headlines like this one from Bloomberg. Mnuchin plans to put $455 billion beyond Yellen's easy reach. All it's saying is that the money will go back to the general fund and that Yellen would need congressional approval to spend it, just like Mnuchin would. This is literally what Mnuchin said in his letter to Jerome Powell. We went over this last week, but just to remind you, he said, I am requesting that the Federal Reserve return the unused funds to the Treasury. This will allow who? Steve? Trump? Who? No, Congress. This will allow Congress to reappropriate $455 billion. I don't see what this headline is here. Steve made it clear from the beginning that, yeah, this is money. If the Federal Reserve returns it, this is money that Congress would have to appropriate. It's not the Treasury Secretary's discretion to give it back to the Fed or do whatever he or she pleases with. Mnuchin is not the most likable guy. Plus, he's a Republican. Or is he? And he was kind of mean during the last financial crisis with the foreclosures and all that, so obviously the media is going to spin this a bit. Here's Axios. A move by Treasury Secretary Steven Mnuchin could handcuff his likely successor Janet Yellen's ability to immediately restart Fed economic programs. Handcuff? Really? I mean, you guess you could say that. He's also handcuffing himself right now, right? Taking this spin on it. Then it says Mnuchin is planning to shift $455 billion in unspent CARES Act funds into a special account that would require Congress's permission to access. Special account? It's called the general fund. And yes, you generally need congressional approval to spend from it. Yellen likes the idea of fiscal stimulus in the wake of this crisis. She has said as much. Would she even try to get this money back to the Fed? I don't even know. I mean, if she did, I think she would lose what popularity she has among congressional Republicans who may fight that move tooth and nail. In terms of Congress, it is reported that progress is being made not on COVID-19 stimulus negotiations, but on government funding. It's reported that the Democratic chair of the House Appropriations Committee, Representative Nita Lowey, and the Republican chair of the Senate Appropriations Committee, Senator Richard Shelby, have agreed on allocations for the spending bills. So that's good news. It's not directly related to stimulus, but at least maybe that fight will be smaller than we originally thought it would. Unemployment data came early this week because tomorrow, Thursday, is obviously a national holiday. 778,000 new jobless claims last week, up from 748,000 the previous week. That's the second straight week of increases. We need stimulus, folks. Washington Post this morning, 26 million Americans say they don't have enough to eat as the pandemic worsens and holidays nears. This is supposed to be a time where we come together with family and friends. Well, we can't do that, COVID-19. And it's supposed to be a time of, sorry to be cliche, but happiness and joy, right? But for millions of people right now in the United States, that is not the case. The Post reports that experts say it's likely that there's more hunger in the United States today than at any point since 1998, when the Census Bureau began collecting comparable data about households' ability to get enough food. We're in the worst it's been right now. Look at this chart, just comparing November 9th, which is obviously a couple weeks ago, so it might be even worse now to May 12th. 12% of all adults in U.S. households that sometimes or often don't have enough to eat in the past week. That's 1 in 8. And that number is 16% in households with children. That's crazy. That means that about 1 out of 6 adults in U.S. households with children sometimes or often didn't have enough to eat in the past week. And in certain parts of the country, it's even worse. The Post reports that more than 1 in 5 adults in Houston reported going hungry recently, including 3 in 10 adults in households with children. That is absolutely terrifying. And this is one of the reasons why a group of 127 economists in a letter called on Congress to send more stimulus checks, calling direct cash payments one of the quickest, most equitable, and most effective ways to get families and the economy back on track. They actually call for recurring payments, right? Pretty slim chance of that happening, honestly. I mean, they can't even get a second round of $1,200 done. Let's be honest here. They talk about how at least half of families have experienced serious financial trouble during the pandemic, with low-wage earners, women, and black workers hit hardest. They say stimulus checks have been an essential tool to keep the number of people in poverty from going even higher. I will put a link to this letter in the description below if you'd like to read the whole thing for yourself, as well as see the names of the 127 economists from leading universities who signed it. If the federal government fails to act, I do hope that we do see more states and cities taking stimulus into their own hands. But of course, it's tough for some states right now, given budget constraints. But for example, Minnesota, Governor Tim Walz is proposing a one-time $500 emergency payment to families and extending unemployment benefits for 13 weeks. In terms of COVID-19, we had 176,439 new cases nationwide yesterday, with 2,203 deaths. That is the highest number of deaths in a single day since May 6th. Remember, deaths lag cases, right? It's not rocket science. White House Coronavirus Task Force this week issued a warning to Americans that the aggressive, rapid, and expanding spread of COVID-19 cases requires a significant behavior change from all Americans ahead of the holiday season. I will put a link to the CDC Thanksgiving guidelines in the description below. Also, this is interesting. Speaking of the CDC, you know how right now, if you're exposed to COVID-19, you're supposed to quarantine for 14 days? Well, yesterday, a CDC official reported that the CDC is considering shortening its recommendation for how long you should quarantine after potentially being exposed to someone with COVID-19, from the current 14 days to somewhere between 7 and 10 days, but also to get a test to make sure you're negative. This individual said obviously tests aren't perfect, but he said that there's a trade-off here. Maybe more people will comply with these guidelines if the quarantine period is shortened. In terms of a COVID-19 vaccine, Operation Warp Speed officials said yesterday that they estimate that 6.4 million doses of Pfizer's vaccine will be distributed to states by mid-December, assuming the FDA gives it emergency use authorization, and it will be up to states to determine which individuals will receive the initial round of dosages. So the Department of Health and Human Services is working on putting out recommendations as far as which individuals should be prioritized. For example, probably healthcare workers, frontline healthcare workers, nursing home residents, etc. Also, speaking of states, do you remember contact tracing? How everybody was talking about that at one point? Well, as you know, we've never had a national contact tracing system. It was essentially up to the state and local governments. And now they're saying that given the huge number of cases that we've seen recently, it's become essentially impossible to win that battle of contact tracing, and some states are reducing their contact tracing efforts or even abandoning them altogether. All Maine is going to do now is reach out to each new COVID-19 patient once to make sure they're quarantining, not even doing any contact tracing, really. New Hampshire said it would only trace cases of people connected to outbreaks or in at-risk groups. North Dakota, for a while now, has given up on contacting everybody who may have been exposed to COVID-19. So yeah, at this point, given the skyrocketing cases, state and local governments simply don't have the resources to implement their former ambitions regarding contact tracing. New York City is adding COVID-19 checkpoints at certain bridges to enforce quarantine restrictions around the holiday. In international COVID-19 news, a Malaysian disposable glove manufacturer, Top Glove Corporation, which makes gloves as well as face masks to protect against COVID-19, has ironically seen over 2,400 of its own workers in November alone being infected by COVID-19. Many of its workers live and work in very crowded conditions where obviously something as contagious as coronavirus can spread very easily. Also, the WHO is saying that COVID-19 cases are dropping in Europe. France, for example, has announced that it will ease up on some restrictions this week. Also, Sweden's state epidemiologist has said that as of right now, they see no signs of herd immunity in the Swedish population. Many proponents of herd immunity like pointing to Sweden as an example of herd immunity, given that Sweden did not really implement lockdowns. But now Sweden's top epidemiologist is saying, nope, we actually don't have any herd immunity here. He pointed out that there might not have been a lockdown implemented from on high, but he said that the Swedish population did change their behavior in response to the pandemic. Less traveling, for example. So there was still something of a self-imposed lockdown in Sweden by the population. It wasn't like they were just living their life like we all did back in the good old days of 2019. All right, everybody, that is my update for today. Thank you so much for watching. Stay tuned for part 2 of that video with Dr. PJ later today, and I will see you in the next video. Bye-bye.